Side bends 2, rotates away. Alright? So you're doing this, let's have someone come up and lay on your back. So its action is side bending 2, rotating away, right? So you're going to side bend away and rotate 2, right? That type of scenario. So I have to, again, since we're talking about chin tucking, or since we're talking about the cervical spine, we want to think about a chin tuck. In this position, if I wanted her to, she might feel a bigger stretch. Try a little bit of a chin tuck. And then kind of let it relax. So there you go. So I don't want her to be aggressive with it. And then I'm going to depress shoulder, right? Side bend and rotate. More or less stretch. More stretch, all right? Because she's basically setting her head into that neutral position. So when we look at what I've written down there, it says step 1 would be chin tuck, right? So chin tuck means bring it back. But what she did at first, and again, it wasn't wrong because I told her chin, she kind of pulled it back and just kind of held it real tight. You can't be resisting me too much. So you got to kind of pull it back into position and then let it relax, all right? So we want to do that when we're testing, when you're doing this stretch. Do it out of chin tuck and in chin tuck to make sure you feel the difference, okay? So then we're side bending opposite, rotating toward. Stabilizing the head. Again, you got to stabilize the rib cage / clavicle on the other side, okay? How we do self stretch with that, right? That's this guy, right? We need to stabilize something. So that's stabilizing here. I can side bend away, rotate 2. That's kind of my self stretch type deal. Again, I should theoretically try to do this from traction. Let's have you set up over the edge. These suboccipital muscles, these are always, they're probably your least favorite and they're mine as well to kind of stretch. Again, this is that concept that goes back, this is a little bit of review, goes back to where we're trying to hook onto C2 and we're trying to stabilize C2. Remember, C2 is the first, is the only, or not only, is the first spinous process. There's not a spinous process on C1. So we find that little hole and then we kind of hook our thumb onto C2. And we hook our thumb onto C2, we have them in a retracted position, and we have them go forward, right? And we're going to see if we get it. So that's why it says stabilize C2 with the thumb, and then it says and nod, all right? And again, we're going to minimize or caution with overpressure. So, scoot towards me just a smidge. Thank you. So we're finding the empty space, not our whole head. That was a joke. And then I'm basically going to push down on C2. So when I get there, I'm kind of hooking down on C2, and then I'm going to have her nod forward like that, right? And I can kind of give a little overpressure. When I feel C2 really wanting to lift up in my head, into my hand, I'm sorry, that's when we're done on the stretch, all right? I feel this best, and I don't know if she felt much there, I feel this best if I retract and take my hands and kind of do this type of maneuver, where I do that. So I'm kind of tilting, so I'm nodding my head a degree or 2. You should feel a pretty good little stretch there. Most people have tight suboccipitals, right? Why? Because we have forward head, right? So I'm here, so subsequently because I'm here, I have to do this. And when I do this, this makes these guys tight. And that's where a lot of headaches come from. So being able to stretch them is pretty important, all right? I'll lay back to your back. Which gets us back to manual cervical traction or a suboccipital release. Not the same, right? Manual cervical traction is just in this position. Why would I do manual cervical traction? What's the purposes? What's indications, diagnoses? Open the foramen. So it can be anything. It could be all of those diagnoses, arthritis, disc, etc. And it should somehow reduce either pain or some sort of symptoms down there. Do you put them on traction the first day or do you do manual traction? It all depends on you. I like manual traction. I like to see, is it going to help? So it's literally just grabbing a hold, right? Letting them relax, right? And then if I'm going to be here for 5 minutes, I want to get myself in a pretty good position, and I'm just giving a little tug up, just making sure she's relaxed and I'm hanging out there. What's the problem with manual traction versus mechanical traction? Well, I don't know how much force it is. I mean, am I pulling it 40 pounds, 80 pounds, 10 pounds, 20 pounds? I don't know. Right? But I can do the same thing. I can do intermittent traction so I can let it off, right? I'm really just trying to get what she does. I usually do way less, like 5 minutes or so, just to kind of see, do we like this, do we not like this, does this change anything? If she had no difference, I might say, well, I don't know if my force was adequate or if I were there long enough. Next time, as long as she wasn't negative, I would do mechanical traction. You guys done mechanical traction already?
Mm-hmm.
Yeah. Give me some parameters. What do you think?
35-degree angle. Can't be more than a 45-degree
25
pull.
pounds is one option.
It depends on.
What's the max?
15.
What's the max?
You can't go more than 45. 40.
Yeah, I think if you go 40, I think if you type in 40, we can turn the machine on and see, it actually says, is this a lumbar spine? So you have to override and say, yes, it's a lumbar spine. So 39, I think, is the maximum. 39 pounds is a ton of poundage on a head, right? I do that with like, nobody in here has a head big enough for me to do it to almost. I mean, a big shouldered, big headed guy, and I would get there weeks down the road, right? It's all, I'm not telling you what's right. I start, what's an average head weight? Yeah, 8 to 10 pounds. So I need more than 10 in order just to get some separation, right? So I'm usually starting in the, it can depend on the chronicity. I'm usually starting 15 pounds, working up 3 or 4 pounds a time. So 15, 19, 23 until I find a spot, all right? Suboccipital release, we'll come back to this. Suboccipital release is just using your fingers as kind of a poke up into the suboccipital muscle, so it's like deep pressure. So I'm telling her to basically, when I get my hands in the position, she's basically going to relax her head as if it's like a stick of butter melting over my hands over time. So you can kind of move your fingers back and forth a little bit, but you're just digging in, so it's a deep pressure to give relief. We can again tell a person to do this with tennis balls. We can go back to the table if you want to. We can tell a person to do that with tennis balls. There is actual pieces of plastic you can buy that look like it, that they can lay on it, or rubber, if you want to do that in your clinic. Okay. Back to traction. What do you do with a herniated disc? Intermittent or constant?
Constant.
Usually constant. Now now I'm going to tell you this. Don't write this to be gospel because I don't know what the book says. But my book used to say basically we would start with intermittent because it's a less aggressive. But if I think it's a disc, I eventually want constant, right? Because I want tissue fluid to imbibe. I want fluid to come back into the disc. What's the time limit on that?
15 minutes. 15 to 20.
And again, don't write this down. I'm just sparking debate here more than anything else. We do no more than 10 if it's constant. If it's constant force 10. Why? Because we can imbibe too much fluid. If we do intermittent, we're right. We work up 15, 20. Now again, that might not be what your book says, so I don't want to confuse you. I'm just simply trying to get you to think about some things. About, hey, what force am I supposed to use? What was normal? 15 to 30. Okay, what's my time? 15 minutes, maybe 20 minutes. But in my case, if I think it's a disc, I never do more than 10. That doesn't include ramp up and ramp down time. So I might have a 2-minute up, a 10-minute, a 2-minute down. Yes, ma'am.
What is our goal for them to feel eventually over time, or for traction? Is it to basically just, we want to decrease their symptoms? And if we don't,
So,
then what's the next step?
best case scenario to how I see traction work clinically is I like it most with radicular symptoms. Now this is, again, now you're getting into my personal opinion here, so take this for whatever you want it. And basically what I want to see is I want them to tell me that their symptoms are reduced in any way. So if they leave and say, man, that felt good for 2 hours, that tells me that doesn't help me, so I need more force. So if I did 20 pounds, I need to do 24 pounds. And if they say, hey, now this is the best case scenario. That was awesome for 36 hours. All right, we're working on something now. I'm going to go up a little bit more, 26 or 27 pounds. If that time they come back and say, hey, this has been better since the last time I was here, now I got you where I want you, pretty much. So that's my goal. Just keep it there then, because there's a force out there that's too much, right? There's a force that I pull too much, and now my muscles, my ligaments start hurting, and then I'm going too far that way. So my goal is to get you to the next treatment with improved symptoms. And if I keep doing that, what I'm saying is I'm pushing the disc in and it's staying in. I'm pushing the disc in and it's staying in. That's what I'm looking for, all right? If I'm using it for a nerve. You can use it for like stretch of muscles and things of that nature. it would be a similar concept. Like if you have neck pain and you're using it for arthritis, it would be symptom relief. But again, then you have to decide how long is enough. Like if you feel great for 2 hours, is that helpful at all? I don't know. If it feels great for one day but always comes back and you got raging arthritis, maybe you buy yourself your own machine, you do traction every day, and you feel pretty good about that. You know, you feel good for a day. You do it every day, cost you $300.
So if you
there
had
you go.
someone that said it hurt, would you immediately stop? Cause like I have a patient right now
Yeah.
who after every time he's like, well that hurt, and we're like, okay, so we won't do it. And he's like, but I think it's helping over time.
Yeah.
And he's like, I think he's addicted to it.
Yeah, well, I would say, yeah, you do see if it hurts, like when you get off, but has benefit overall, if you understand what that means,
Yeah.
I'm okay with it. If it just hurts and doesn't really help, then I don't do it. But you're right, that's one of those guys that maybe, I don't know, but you know, it might be one of those, at least when he does that, he's feeling like it's doing something there besides just your exercise or whatever else you're doing, you know, so he's wanting that a little bit. Let's do those things, so do a little bit manual